So what I'm going to talk about today is how MESSA can help you build your worksite wellness program. We'll talk about some of our health survey tools and our assessment resources, some planning resources that you can use for your worksite wellness conference, your worksite wellness program. This can be virtual or in your building on your worksite. I'll also go over some information to help you create activities and programs that you can offer your colleagues, okay? And we'll end it and I'll share some of the MESSA wellness programs that can help your worksite wellness programs in your endeavors. First off, the health risk assessment, the health interest survey, and the report card. These are survey tools. When you're thinking about building a worksite wellness program, the first step you want to take, because you want to customize your program, you want to actually meet the needs of your colleagues and coworkers. How we do it is we start with a survey. Now, what we can do for you and for your members is we offer a health risk assessment. Our health risk assessment can be found in our member portal on our MESSA website, okay? This is a assessment that you can lead your members to, and it provides them immediate feedback on their individual risks, okay? That's what it does for our members and for you. It's found on our website in our member portal. As program planners, what it does, it provides an aggregate report and it shows you the risk in your population or your group. So when you're sitting at the table with your wellness team or your wellness committee, or perhaps you are the one person leading this initiative, I can provide you a report and it'll show you where the risk is or the weaknesses in your group. So for example, it can show you that perhaps the people in your group are not eating enough fruits and vegetables, or perhaps the people in your group may not be getting enough exercise, and there's a high prevalence of sedentary behavior. For your program planners, this will let you know that, okay, we need to plan a program that would educate our people on how important physical activity is, or educate our people on how important it is to eat fruits and vegetables. Again, this is our health risk assessment. It's free to MESSA members. It's located on our webpage in the member portal. So you can do a campaign, for instance. A lot of school districts, and we have done this as well, as we'll start the year off with a campaign, a health risk assessment campaign, because most people in January, they decide they want to make a change. They decide it's time for me to take on my path of wellness. So we push that campaign out, making people aware of this tool and that they can use it. And what happens is it's a questionnaire. It takes about 15, 20 minutes, and they get immediate feedback and a wellness plan that they can follow. It's a great tool to use. Another survey instrument that we provide is a health interest survey. Now, the health risk assessment, that can be done individually. The health interest survey, you are surveying your population to find out what kind of health activities are you interested in. So often, program planners and committee members will sit at tables and make great plans. And when it's time to roll it out and it's the day of the activity, we're upset because no one showed up. Why aren't they showing interest? Why don't they want to get healthy? But really, it starts at the beginning when we engage them in the process. Doing a survey engages your population in the process. You are letting them know you want to know what they want to do. What are your interests? What types of wellness activities are important to you? So we can help you with that. We provide a template survey just to help inspire your own creativity. You can add customized questions to this survey because you know your area. You can bring the more subjective information to the survey. So you're asking questions like, what is your preferred communication method? Do you respond to emails? Are you looking at your email for information? Or would you prefer to see information in the break room? Would you prefer information about wellness on our webpage? The survey instrument can get that type of information from your population so you can actually really target in on that group and do exactly what they really are looking for. Thus, the outcome is you have a higher participation rate. Your communication methods are targeted. Again, it contributes to a higher participation rate. One thing we've learned with worksite wellness, we might not always get people to change behavior, but if we can get them to the activity, if we can draw them to the program, put them in a position where at least they're hearing the information, that increases our chances of helping them change behavior. And you and me, we're behavior change professionals. The simple fact that you're here at this conference, I know you are compassionate about helping people make right choices and change behavior. Well, the simple fact that people come to a situation to listen, the chances of them changing their behavior is much higher. And sometimes it takes a couple of more sessions or it takes a couple of more activities. Don't you get discouraged. Just keep providing the information. Keep bringing the horse to water. Eventually the horse will drink. And don't tell your colleagues I'm calling them horses, but you know how that goes. So our health interest survey, you can get that on our website. You can contact me at healthy@mesa.org and I can send you this tool. And again, we have it so you can customize it to your architecture, your environment, your population, and ask the questions you need to ask. Our third tool is our wellness report card. And this is a pretty nifty way of planning or gathering information to plan. We call it our report card. And basically it tells you what your population, your MESSA members, their healthcare utilization habits. So as your health insurance, we want to make sure that you are making the most of your health benefits. We want to make sure our population, our members have access to health screenings. We feel that that is very important. And the research supports it. When people engage in health screenings, when people get their physical, when women get their mammogram, when adults get their colon screening, we know that that provides an opportunity for healthcare providers to catch things earlier. And if we can intervene earlier, it's more likely that the treatment will be better and more effective and even less costly. And even it could minimize the emotional burden. So we promote health screenings and healthcare. Of course, we're MESSA. The report card lets us see a de-identified, there's no names in this. It's an aggregate report of your population, and it lets us know their annual physical behavior. What percentage of adults are getting their physical? What percentage of adults are getting their cancer screenings? As a program planner, what that does for you, you bring this information to the table, coupled with the health interest survey and the health risk assessment aggregate report. You have a nice collection of evidence and information to guide your planning, okay? So let's say the report card lets us know that most of the adults that have MESSA in your district or at your work site, let's say it's 30% that are getting a physical. Now that's concerning because this is a benefit, a preventive care benefit. So it's free, number one. And number two, your annual physical is your way of developing a relationship with your healthcare provider. You don't have to be sick to get an annual physical. It's something you do while you're well. Okay. And people that have a relationship with their primary care provider have better outcomes. Okay. And it's at this visit that your healthcare provider will let you know, okay, Rhonda, it's time for you to get a mammogram. Rhonda, it's time for you to get your colonoscopy. They guide you through your wellness journey. Okay. So we want to encourage everyone to get their physical. And as the worksite wellness team leader or wellness team, this could be a campaign you do at the beginning of the year. You know, during the pandemic, that wasn't our first priority. But now that things are less strict, we want to encourage people, go check with your health care provider, make that appointment for your physical, make sure you are doing those things to help you maintain good health. And you can help us doing that by putting that in your worksite wellness plan or your worksite wellness programming, a campaign for physical. So you would just contact your MESSA field rep and they can generate a report for you, or you can contact me at healthy@mesa.org and we can get that for you. So some planning. So we have our information, we have our evidence on what we are going to use to create our worksite wellness program. So MESSA has a toolkit for you, a worksite wellness toolkit to get you started. Again, our webpage, we want you to visit. You can tell I want you to visit our webpage. I get points for this, okay? So go to our webpage today. So when they run a report, they know you went, and download this toolkit. This will get you started on your worksite wellness endeavors. I'm trying to make it easy for you. That's my goal. You download the toolkit, check it out, and it'll guide you through how to at least get it started. Now, as the health promotion consultant, I don't know if I mentioned this, one of my responsibilities is to work with you, our school districts, and to help you develop this worksite wellness program. I will come and sit with your wellness team, or rather, I will log in on your Zoom and sit and help you plan. And I will help you with wellness best practices. I've done it before for our headquarters. I've sat with other districts, so I kind of know the nuances. I know I can kind of help guide you towards those programs that really work versus those programs that probably, I would say, nah, you don't want to do that one, not this time. I can help guide you. I want to make you successful, okay? I want to make it work for you. I want to make you shine. So as a health promotion consultant, that's what I do. We put together this toolkit to help you, guide you, get you started. Within that toolkit, we have a wellness activity calendar. Again, why recreate the wheel? We have it for you. We have the wheel and we're giving it to you. So basically, when you sit with your wellness team, this calendar can inspire you on activities. These are activities we've done. These are activities other school districts have done, and we set it up in a calendar so you can see when it is a good time to do these specific programs. And you may already be aware of this, but there are national health observance days and months, right? Like October is Breast Cancer Awareness Month. This month, we are raising awareness of breast cancer, and we're letting people know about research and how they can contribute to it, the risk factors and things you can do to minimize your risk for breast cancer. There is a health interest for every month. So you can use that to guide your campaigns. This is the tip. This is the side tip, pro tip, free tip for you. After you look at your survey results and you see what your group wants to do, you look at the national observances, from your evidence, you see that your group is sedentary and that your group has a high risk for cardiometabolic disorders like diabetes and heart disease, okay? And then you look at the national observance calendar and you see that February is heart disease month. Are you with me on this one? So that's a campaign right there. We already know your group has a need for it based on our surveys and our report, our wellness report card. And we know this February is coming up. So why not do something to raise awareness of heart disease, the risk factors of heart disease? So you can plan things throughout that month related to heart disease. So that is how you target your group. And what happens, and I didn't say this before, but what's so nifty about the report card, if you are using that as your baseline, you can run another report card, let's say in 18 months. Once you do your campaign, you execute the intervention, you do your program, you collect the outcome of your program, and a year later, get the report card, or a year later, do another survey. Have your people do another health risk assessment, and you compare the information at baseline to the information 18 months later or 2 years later, and you can see and celebrate your progress, okay? Those are ways you can measure how well your activity and your program is doing. Health and wellness campaign templates are also available in our toolkit. Again, this is to help you. So you don't, I know you guys are busy. This is an extremely stressful time for all humans. But I do know pre-pandemic, our school employees were already facing stress. So I know, I don't know how you feel, but my heart goes out to education employees, and I want to do what I can to help you. And I believe wellness is the answer. Wellness can help us all individually and as a group. So we have templates for you to help you. So I mentioned the health maintenance or the physical exam screening. Our templates can help guide you step by step. We have templates for chronic disease management, okay? We have programs here at MESSA that can help you. We have nurses that are health coaches, but you can create a campaign with that. Also, self-care and mental wellness. Those things are important right now. We really have to start paying attention to our own health and making sure we're taking care of ourselves mentally and physically. And as MESSA Wellness, our concept or our pillars of wellness, they're mindfulness, movement, and nutrition. Okay, that's kind of our philosophy in 3 words, our wellness philosophy. Because these 3 things, when you unpack those concepts, mindfulness, you know, put it into action, movement, put it into action, nutrition, put it into action, it's kind of the answer. It's the answer for self-care. It's the answer for chronic disease management, diabetes, heart disease, asthma, when you do mindfulness, movement, nutrition. It's the answer if you're already healthy and you want to sustain health, mindfulness, movement, nutrition. So if nothing else you get out of this conference, okay, I want you to walk away with those 3 concepts. And you will hear those concepts with our 3 speakers, mindfulness, movement, and nutrition, okay? So let's say you just decided, okay, Rhonda, I'm so busy. I know my district or my colleagues, I know their issues. I don't have time for a survey. I want to do a survey next year though, but what can we do right now? Okay, what can you do right now? You, as far as mindfulness goes, now this will work brick and mortar or virtually, doing a mindful Monday, sending out messages that would remind people to be mindful. You know, mindfulness is an intentional exercise, just like you have to intentionally go walking or get on the treadmill or decide to go to the gym. Mindfulness is a practice that you have to be intentional about. You know, mindfulness is about focusing in on the moment, the present, and without judgment, without any negative emotions, versus what we do most of the time. Either we're ahead of ourselves, worrying about the future, worrying about the next hour, which causes anxiety and dread, or either we're behind ourselves, okay? Worried about yesterday and regret, shame, remorse. All those types of thoughts and emotion trigger our brain to put us in fight or flight or survival mode or stress, we call it, okay? So mindfulness practice, and it's so important. That anxiety and depression right now is so important to find moments to get out of that and get into the present, okay? A message on Monday to your colleagues, a simple message is a great way to do that. Gratitude. There's a lot of research on gratitude, you guys. Google it, okay? But what we know about gratitude mindsets is your mind cannot be anxious, worried, negative, and grateful at the same time. But the key is you have to be intentional about it. So what can you do on your work site? A gratitude appreciation board, posting and letting people know that you just appreciate the work they did yesterday. Thank you for coming in work today. Thank you for logging in the Zoom meeting today. Oops, we went ahead of ourselves on here. Thank you. And just me saying this, I'm gonna tell you, it works 2 ways. When you express Thanksgiving, what happens physically, our bodies are set up this way. Our bodies release feel-good hormones, like you've heard of serotonin. But for the receiver, it causes them to release the same hormone, okay? Potentially, when you release serotonin, you're lowering cortisol. And we know that cortisol, this is a side free tip. This is totally outside the conference. Cortisol being released too often can compromise your immune system, putting you at risk for these ugly microbes in the world, okay? Bacteria and viruses. So potentially you can keep your work site well. You can help your colleagues' immune system by practicing Thanksgiving. Mindfulness through Thanksgiving appreciation. 30-day resilience challenge. I have some books called Stop Stress Now available that have that 30-day resilience challenge in it and can help you through that. Contact me, okay? These activities can be done virtually and they can be done on the ground. I call it on the ground, brick and mortar. These are my terms, okay? For in your school when you are reporting to the building. And meditation, you know, at the beginning of this year, around April, March, what we did is I did a self-care challenge. It was just, we had to make moves quick. Everything just changed just like that. And I wanted to make sure I could connect with my members, with you guys. So we just started doing Zoom self-care sessions and we talked about mindfulness. And it was such a great response. And it was so helpful to me just to connect and see people. And it was so helpful to the people that participated. I encourage you, especially as we start entering these winter months and people have been isolated for so long, that you practice one of these, that you start one of these activities and contact me and I'll help you get it started. I've done it before and that's what I'm here for. Movement. Movement is not just about joining a gym. Movement is about sitting with good posture. You know, we're all the Jetsons now. We sit in front of these screens all day. You guys, am I the oldest one in this space? Because I remember the Jetsons and I never would have thought that I would have lived in a day that I exercise on a screen, I work on a screen, I talk to my friends on the screen. We are truly the Jetsons. But we cannot negate the need to move, okay? Our bodies are built with arms and legs that are meant to move. So we have evolved into an infrastructure that doesn't promote movement. So again, just like mindfulness, we have to be intentional. That may mean during the day, just engaging in good posture. You know, if I was in there with you in this Zoom room, I would sit next to you and grab a chair. If we were at a conference center, I'd show you how to sit in good posture. But I'm gonna just tell you, and I'm watching you right now. I can see how you're sitting. Yep, I see some people. Yep, there you go. Thank you. You already been in my sessions. But when you sit in good posture, and I'm telling you guys, this is the first step to fitness. It's sitting right. Because you automatically engage muscles. You're working your muscles isometrically, okay? And what you do, and when you're working your muscles, you are burning more calories than when you're not. So that means you're contributing to your total daily calorie expenditure. Let me put that in lay language. You are burning more calories so we can look better. I'm just saying, okay? But listen, so good posture is sitting up, shoulder square, ear to shoulder when you're sitting, shoulder to hip. And as soon as you sit up, you're going to feel your core engage and you're going to pull your navel into your spine, okay? Not only is this more, it probably feels like work after a while, but you're protecting your lower back, okay? One of our largest or most prevalent disability claim is low back injury, low back pain. You know why? People are sitting and they're sitting with negative emotions and that makes you slump over and that puts stress on your lower back. So I want you to be aware, mindful of how you're sitting and sit with good posture. Move around your office, move around your workspace, just moving, okay? And these are the type of things you can encourage your colleagues to do via challenges. Step challenge or walking challenge. Now, everybody knows about Fitbit, and I think that's free when you buy a Fitbit, but there's free online walking challenges out there, okay? One is called Count It, write that down. It's free. You can do a worksite challenge on an online platform, just like Fitbit, for free. It's called Count It, okay? And log in. A push-up challenge. Okay, help your colleagues with their upper body strength. Plank challenge, help your colleagues strengthen their back to prevent lower back pain, okay? Why is movement so important? It increases your circulation. It helps delay the onset of chronic disease, okay? It increases our longevity, a quality of life, okay? We want that for us and we want it for our colleagues. Go to our website. In our toolkit, I have some challenges set up for you, some movement challenges. They're there for you. I want to help you, okay? I do have background in fitness. I'm a retired professional bodybuilding athlete. So I'm really, really into fitness, but I'm into mindfulness too and nutrition too. So I want to help you. So nutrition, our third pillar of wellness, challenges you can do with your group. a 21-day mindful eating challenge. Okay. So basically, you're using the precepts of mindfulness, focusing. Okay. And you're giving your colleagues information for 21 days to help guide them through their journey of mindful eating. Why is mindful eating so important, Rhonda? I just want, let me just stuff it down my face. I'm hungry and I'm in a rush. That's why it's important. Because you know what? I know we all eat because this food is delicious. But really, the real reason we eat is because we need the nutrients in the food, okay? Especially when you're under chronic stress. Your body's using things up. It's using the stores up. Your body uses up vitamin C every day. You have to have vitamin C every day, new vitamin C, and B vitamins every day. And those are important to keep your immune system strong. So if you don't replace it, you are compromised. Your immune system is vulnerable, okay? So we need to eat food that is healthy, that has these nutrients, but we also need to eat it mindfully, because when you eat stressed and distracted, anxious about tomorrow, regretful about yesterday, your brain sees that as a threat. And what your brain does is it releases cortisol because it thinks it's protecting you. And when cortisol is elevated, your body can't pull nutrients out of food. It just is a waste of time. It can't pull out the vitamin D. And we need that vitamin D to help our immune system. It can't pull out the vitamin C. So that's how mindful eating, it shows us how to slow down and to chew so we can get optimal digestion and assimilation of the nutrients out of the food. Now, what's important with that is, in order to get the nutrients out of the food, we got to eat food that has nutrients in it. Right, right. Like, what do you eat when you are being mindful? Potato chips, right? You eat carrots and cucumbers every day. I know you do. I don't. But this is the thing, when when I'm under stress, I'm gonna tell you, I go for the chocolate. But this is the thing, what mindfulness does, it helps us slow down and make good choices. Helps us think about it. Because when we're rushed, we just want the salty, the sugary, the savory. So that is something you can do for your colleagues. If you're on site, salad jar lunches. If you're not on site, let's exchange recipes, okay? Email recipes. Designate a day where everybody emails recipe, and you have to send an image, okay? A newsletter, okay? You can do this if you're brick and mortar or virtual. Put out a newsletter once a month or every 2 weeks that has recipes that you're sharing with your colleagues. You basically are helping inspire them to change behavior. Behavior change is not always immediate, but it's helpful to have information, and it's helpful to see things. It's helpful to hear things. So that's why we create programs. And because we're at work most of our day, that's why we want to bring it to the work site and the workplace. Now, MESSA has resources for you, okay? We have some experts, we have programs, and we, of course, you heard of the tools. I'm one of the experts. I'm the health promotion consultant. I have to say this. This is what the slide says. I know it sounds like I'm bragging on myself, but I'm at this slide. I'm the health promotion consultant. I am a registered nurse. I have background in fitness and nutrition and mindfulness. I am here to help you, okay? Help you on your work site. And I've been doing this for quite some time. I used to be the cardiovascular health education nurse, and I used to be a medical case management nurse. So I'm very familiar with what MESSA has to offer. Now, our greatest superheroes at MESSA, and I'm not just saying that because they're in the room. I admire them so much. Our field reps, okay? And they're in the house. If they want to wave, go ahead and wave, you guys. They help you understand your benefit. They are there. They're not only working with you as an individual, they work with you as groups. They want to make sure you understand the greatness of MESSA, okay? So they're here for you, and they're actually on the platform today. They came and they joined us today. They are the ones to call when you have questions about your benefits. Our member service, we have an award-winning member service center. And when this pandemic hit, they were ready to do what they needed to do to make sure they were servicing you, okay? So we stayed the award-winning center even throughout the pandemic. I think they rose to the occasion and were ready on the phone to meet your needs. And now at this point, you can contact them at an online chat on our website, or you can call our number and contact our member service center with any questions. Our case management program, I alluded to that earlier. That was my first location when I came to MESSA, our medical case management program. Okay, we have registered nurses that are educated and trained specifically in these areas: asthma, cardiovascular disease, diabetes, and case management. Now, when I say specifically trained, in nursing, we have to do continuing education to keep our license, just as a registered nurse. But in order to be called an asthma educator or a cardiovascular educator or a diabetes educator, there's higher requirements and there's education they have to do continually throughout the year to meet that designation. Our nurses have that, okay? Our nurses are accredited in that way. Our case managers have that designation, okay? I'm very proud of them, and please reach out to them. That's a campaign for your worksite wellness program. If you get a wellness report card or you get an aggregate report of a health risk assessment and you find that you have a large population of people challenged with heart disease or diabetes, you can direct them to our case management programs. Our case management programs provide them with one-on-one coaching to help them navigate those conditions. You know, at this point in medical technology, there is not a cure for diabetes. However, there are resources, treatments, and lifestyle measures available to help manage them, where an individual can live a high level health and well-being, okay? Our nurses have that, and they can help coach our members through that. Our online doctor visits, okay, we have been utilizing that like never before during this pandemic. We had it before the pandemic, so we were prepared for this. We have been promoting online doctor visits, and 2020, it was right where it needed to be. They're there for you. If you don't want to go to your doctor for some type of acute care situation, say you have pink eye, say for instance, you have a respiratory infection, you don't want to sit in a doctor's office, especially now, our online doctor visit is there for you. It is a benefit available. Even mental health visits are available online in the privacy of your own home, in your car, using your digital device or telephonically. If you have more questions about those services, our MESA field reps can answer any question. Omada and Livongo. MESA is very serious about helping our members with chronic health conditions, or I'll say also helping prevent chronic conditions, because again, once you have diabetes, we don't have a cure for it or a treatment to reverse that at this point. But if we can delay the onset, we are trying to do that. That's why we offer Omada. Omada is a program for those individuals that have a risk for adult onset diabetes or type 2 diabetes. What you do is you do a questionnaire to find out if you are indeed at risk. If so, you're eligible for the program. The program provides you a health coach. It also has a group setting where you can virtually meet with people who have your same interests, who are in the same type of situation, to share different recipes or ideas with them, okay? And basically the concepts Omada uses is helping people understand the benefits and the importance of physical activity, the importance of good nutrition, and the importance of stress management, that mindfulness movement nutrition. For our individuals that have diabetes, this includes children and adults, we have Livongo. Again, you can access that digitally. It's a program that helps our members who have diabetes. You can get your supplies through Livongo, and you also, if necessary, you can use their coaching services as well. So those are two programs. One is for individuals who are at risk for diabetes. The second one is for individuals who are challenged with diabetes already. OVIA is a program, because wellness to us is assistance and support throughout the whole healthcare continuum. OVIA is a program for our families, our growing families, starting from fertility needs, pregnancy, and even parenting young children, okay? This is an app. There's a library, there's resources to help you, and they tailor the resources to what is happening present time. So there's information on there right now about the pandemic and some tips on parenting your children during the pandemic and some safety measures for pregnant women. So definitely log into that, get on that app or download that app so you can utilize that resourceful benefit. Other online tools, you know, our website, our portal, our My MESSA portal, if you need to check your benefits. And also that's where you log on to the health risk assessment. And don't forget, we're on Facebook, okay? We are sharing health and wellness information, benefit information on our Facebook page and all other social media platforms. That includes Twitter, Instagram, and YouTube, okay? Come, and this particular recording, our speakers will be on our YouTube channel. All of our self-care sessions we did during the spring are on our YouTube channel, so check those out, okay? And again, I am Rhonda Jones. I am your health promotion consultant. I am here to help you build a worksite wellness program. If you are an association leader, if you are a human resource, school business office person, if you are a president of association, whoever you are, whatever your role is, I'm assuming you're here because you are interested in wellness for yourself and wellness for your colleagues. I'm here to help you. You can contact me at healthy@mesa.org.